Hello everyone, this is Dr. Prathyusha Chavva from team Mdsconquer. We just finished the Neet MDS 2025 exam and I hope everybody has given their best. And I'm sure that you did give your best because almost all the questions we have covered in various platforms like our daily discussion boards that we have every day on WhatsApp, which have been continuing from the day one that you have joined MDS Conquer till the D-Day. Okay, every day, whatever we have taught you, whatever the important topics that had to be discussed again and again with you were done in the discussion boards on WhatsApp. Apart from that, to help our students who have joined late, we had the bootcamp series part 1 and part 2, in which we tried to cover the maximum important points pertaining to each and every subject that had given an additional boost to our students who have joined us since the beginning, and also help the students who have joined recently to understand the major important concepts in each and every subject. And we also had innumerable exams, grand tests, followed by mock exams which were taken keeping in mind what will be or what can be asked pertaining to even case-based questions, everything, image-based questions, everything we have discussed. Okay, so I'm pretty sure that you must have given your best in these exams. I want to recall, starting with oral medicine and radiology, just let us have a look at all the questions that were given and how we would have answered and how we covered in various platforms in MDS Conquer. Let us start with the first one. Okay, so this is the first question. Simple question. They have just given one image-based question here. The image is given here, portrayed here. Okay. Name the X-ray view. Now, not only in the extraoral views, the major important aspect, as I have been telling you from day one, was how the film is placed, what part of the patient is touching the film, what part, how is the patient angulated. Okay, these were the three important aspects that had to be dealt in clarity. Okay, so we did the same thing here. They have given a patient, if you can see, the nose and the chin of the patient is touching the film, and it is the cantomeatal line is angulated at 45 degrees to the film. Okay, and the X-ray is passing perpendicular to the film. So what could it be? It is very clear that this is a 0-degree occipitomental. Okay, when I was taking the occipitomental views class, okay, be it your pro-life class or be it your bootcamp series, as you can see here, very clearly we have covered the view also. This is a standard occipitomental view and the same diagram is given here. Now, there might be some ambiguity that some might be saying that, ma'am, only chin was touching. Even if only the chin is touching and the nose is away from the cassette, the answer is still 0 degrees occipitomental. Some might be saying that, ma'am, it's reversed down. It can't be reversed down because reversed down, the patient's head will be touching, chin will be away, and the patient is angulated downwards. Okay, it cannot be upwards. So, your reversed down cannot be the answer. Submental vertex, completely the patient is behind. I mean, the head of the patient is completely tilted behind. This cannot be view, and TA view, the angulation of 45 degrees will not be there. Okay, so the correct answer is occipitomental view. I hope this is very clear. Very clearly we have given in our, this is the pro-life video shot that I am giving you here. Okay. So very clearly I have discussed this and I am sure that everybody must have marked the correct answer. There might be some ambiguity between the options that I am discussing now and the options that these are the options that are collected from students and from various sources. They might not be the same, but at least we are trying to incorporate the correct answer in the options. Okay. So if the options are a little bit different, do let us know in the comment box. Let's go to the next question. Patient comes to you with suspected zygomatic arch injury. As I always tell you, whenever you have a keyword, what do I tell you? You always mark it. Okay. Zygomatic arch injury. Now we know what kind of injury the patient has suffered. Which of the radiograph will help you to come to a diagnosis? So again, another important extraoral view. Okay, we already had one occipitomental view. Another question from extraoral radiographs, right? Again, this is my bootcamp series video where I am teaching you how the submental vertex view is taken and what are the indications. If you can see very clearly, it's highlighted here, fracture of the zygomatic arch. Actually, a modified version, that is jug handle view, is taken, which is best for the zygomatic arch. But since you do not have, many of them told me that zygomatic arch fracture, they did not give jug handle view in the options. So if jug handle view is not given, it is nothing but a modified submental vertex view. So you need to go for SMV view for zygomatic arch fractures. Okay, even in our smart videos also we have covered this. Many times we have covered this topic, which is a very, very important topic. Okay, paranasal sinus view is basically to see all the paranasal sinuses, especially the maxillary sinus, right? Reverse down is for high condylar fractures. And PA view is because of the superimposition. Actually, in PA view, nothing can be appreciated as such. Okay, except for the frontal sinus a bit, right? Next, let's go to the next question. This is a case history based question, probably given with a OPG. 55-year-old male, now old male, okay, old male patient. He is presenting with pain and swelling in the lower jaw. Immediately, what should strike in your brain? All the lesions that could be present in the mandible in elderly patient. Okay, you have to come to a list. The list should automatically come in front of you. What could be the possible diagnosis? Now, additional finding he is giving is left angle and body of the mandible are tender with mild expansion. Whenever you see this term, mild expansion, what comes? This is a key word. Many times I have told you in the class. This is again a smart video picture. This is a smart video screenshot of odontogenic cysts, okay, which you find in our website. Okay, clearly that I have mentioned there, mild expansion, and they have given an OPG. Okay, so what is the diagnosis? So it is probably present. It is probably present in an area which was edentulous. That is what many of my students also told me. So be it edentulous, be it a dentulous area, if they tell you angle and body of the mandible with mild expansion, always your key should go towards OKC. Okay, always the key should go towards OKC. Right? Ameloblastoma will show a profound expansion. Okay. And osteoblastoma and ossifying fibroma, these are mixed lesions. Okay, they are not completely radiolucent. Whereas here, OKC is completely radiolucent. Okay, with mild expansion and mostly located near the mandibular angle and body. Okay, so this is quite clear. If there is any ambiguity in the question, you can always comment, because these are nothing but we just take it from our students and from various sources. So please let me know if there is any ambiguity in the question as well. Okay. Another very interesting, before I go to this question, I wanted to tell you guys that this is a screenshot that we have given. Numericals in oral radiology. Okay, so this was specifically prepared by the team in order to make sure that all the important numericals in oral radiology are covered. Okay, so this was given to the students, to the offline students, and all of them had to attempt this as a small questionnaire before they came to the revision class in oral radiology. So in that same question was asked here, if you can see, distance between X-ray source and patient encephalogram is. What is the answer? It's a simple numerical. If you know it, you know it. If you don't, you don't. The answer is 5 feet. Right? The answer is 5 feet. Very easy, very simple, straightforward numerical question. No ambiguity in such questions. Next question. Which of the following has maximum malignant potential? Same question covered in our grand exam, okay, and also it was covered in our GTs. So if you can see here, highest incidence of malignant transformation occurs in, yes, simple question again. In oral medicine, oral radiology and oral pathology, as I always tell you, it's a highly scoring subject, right? And you tend to get a lot of questions from this area, and we have made possibly efforts, we have taken possibly all the efforts to cover all the important topics so that you do not lose even 1 mark in these subjects, right? So this question has been discussed multiple times on our oral radiology and oral medicine discussion forum also on the WhatsApp. Even in your Telegram, we are conducting daily quiz. Even in Telegram, this question has popped up multiple times, and so did we give this exam in the mock exams also. So same question. Highest rate is for erythroplakia, okay, 80 to 90% of erythroplakia has highest rate of malignant transformation. Pretty easy question, simple one. Next, a syndrome based question, okay. A patient with lower lip edema, facial paralysis, fissured tongue. How many times must I have told you this proper syndrome, okay, which is nothing but Melkersen-Rosenthal syndrome. We discussed it in oral pathology, we discussed it in oral medicine, and also we discussed it when we were talking about non-caseating granulomas, okay. Multiple times we have discussed this, okay, and same question asked in your GT also, okay, GT 12. Melkersen-Rosenthal syndrome is associated with fissured tongue, right? So it's a triad of facial paralysis, lower lip edema, probably due to granulomas, and fissured tongue. Next question again on syndrome. Patient presents with bird-like face, micrognathia, cleft palate and glossoptosis. Okay, very commonly again we discussed. Apart from helping you all with our normal daily discussions and our smart videos and our GTs and mock exams and all of that, we have started giving you specific worksheets designed for you so that you do not spend hours and hours in writing the notes, right? So for you guys to make learning easy, simplified and smart, Mdsconquer designed worksheets, okay. So for students of Mdsconquer, you will know this is a worksheet. We share the worksheet PDFs on our group, okay, in which the notes pertaining to the smart video that they see is already in hand, okay. Whatever extra points they want to write, which are discussed in pro-life classes or which are discussed in offline classes or in daily discussions, they need to just take a printout of this and write it in that, okay. So in anomalies or in syndromes which we have discussed, we discussed same thing. Triad of cleft palate, micrognathia, glossoptosis is Peary-Robin syndrome, right? Peary-Robin anomaly or Peary-Robin syndrome. So this we had given, this is the OPOM full worksheet PDF in which the entire syllabus, whatever is required in and out, whatever can be asked in your NEET MDS has been given in the form of notes specifically to all our students who have joined the PG program, which will help them to learn fast, okay. They do not spend too much of time in writing, so we have covered this in the worksheet as well. Next question, probably a small case history based question. So here 32-year-old female patient, she has a history of tobacco chewing since 14 years of age with reduced mouth opening. Now this is from a smart video that I have taken from the website, okay. White lesions of oral cavity, same thing we have discussed here, okay. What is this? OSMF. What is the diagnosis? Very easy. Lichen planus, you will have Wickham striae, right? Oral thrush, candidiasis, not associated with any history of tobacco chewing. So is lichen planus is also not associated. Carcinoma of buccal mucosa can be associated, but In this, you will have a ulceroproliferative growth, which is not mentioned in the question. Okay, so you can exclude this option like that. So with that, the answer is OSMF. The answer is OSMF. Next, Kuttner's tumor is another name of. Actually, Kuttner's tumor is called as chronic sclerosing silidinitis. Okay, that is the name that is given to it. But you do not see any of those terminologies in the options that are given by the students. Okay, so chronic sclerosing silidinitis. In this, it cannot be a myoepithelioma. Myoepithelium is nothing but a tumor of the muscle cells along with the acinar cells. Okay, it cannot be a lymphoepithelioma. It is definitely not an adenoid cystic carcinoma. So whatever sclerosing silidinitis is occurring, it's because of silometaplasia. Okay, it's because of silometaplasia. So by excluding all this, you can come to a diagnosis of Kuttner's tumor. Kuttner's tumor. Sorry. Yes. The next question. 23-year-old boy comes to you with pain and swelling in the floor of the mouth. If you notice, many questions are not direct. Okay, they are tried to give you all the possible clinical scenarios. If this patient comes to you, how will you diagnose? Or if this is the history, this is the clinical symptom, this is the clinical sign. You have done this diagnosis, what additional diagnosis can you do? Or what is the best radiograph that you can take? So it is definitely asking you to think. Okay, when you think, that is when you actually know that whether you know the subject or not. So I found that this year's paper is very good in that terms, that definitely it made you think a lot more than you are actually used to. So definitely I can say that it's a good paper. Oral medicine, oral radiology, the paper is really good. Let's continue with the question. Pain increases on taking meals. Okay, many times discussed. Pain on taking meals going towards the salivary gland disorder. Okay, radiograph reveals radiographic mass in the submandibular salivary gland duct. Okay, what is the diagnosis? He has given submandibular salivary gland duct. Antronithiasis is in the sinus. Okay, rhinolithiasis in the nose. Silometaplasia does not have anything to do with salivary gland stones. Your answer is silolithiasis. Just before the exam, that is on when we started with our boot camp series, here you can see sir has given single liners about silolithiasis. Okay, which is the most common cause of salivary gland obstruction? What is the most commonly affected duct? What is the reason for that? Okay, how many stones are radio opaque? What is the color? What is the common site? Okay, so everything about silolithiasis has been discussed in our WhatsApp discussion. So no going wrong in this simple and easy question. This is the end of part 2. Before I end this session, I want to tell you all that we have started again such amazing plans, Plan A and Plan Pro, which are online plans for students who are not in Hyderabad, who cannot reach us directly. You are always welcome to join us online. You must have been exposed via Instagram, via YouTube to the activities that we usually do on MDS CONQUER. But we also wanted to show you that we have various modes of teaching which you can get used to once you join the MDS CONQUER MDS 2026 plan. Okay, the admissions have already started. We have Plan A and Plan Pro. In Plan A, you are used to only you are exposed to only the evening WhatsApp discussions along with the entire website access, and also the worksheets are shared with you. You are not exposed to any online classes that we take. The cost of it is around 16,000. And for Plan Pro, we have online classes which are taken on Zoom by regular mentors. Every week we have 3 classes. The dates will be announced along with the question papers that are shared on the group, and the discussion happens along with the question paper. Even if you miss the live class, the recorded version of the live class will be uploaded and you can watch it later. Along with Plan A, this is the additive benefit for Plan Pro students, that you are exposed to online live classes by esteemed mentors in MDS CONQUER. We have been doing it for the past 10 years. You will be our 11th batch. Please do come and join us and have a wonderful time and crack the next MDS 2026. Thank you so much. See you in part 3.